This unprecedented wave of superflu is leaving the NHS facing a worst-case scenario. This is backed up by the data. On any given day last week, an average of 2,500 patients were in hospital beds, a 55% increase on the week before and almost double the numbers from 2023. 106 flu patients are in intensive care compared to 69 the previous week. There are 1,300 more staff off than the week before, and the number of calls received by NHS 111 last week was 446,000, 8% higher than this time last year. It is clear from both the NHS and UKHSA data that there is a real risk for the NHS and for patients. And it is at this moment of maximum danger that the BMA has chosen to go ahead with Christmas strikes when it will inflict the greatest level of damage on the NHS. The BMA said this dispute was about pay, but we gave them a 28.9% pay rise. Then they said it was also about jobs, so I offered a deal to halve the competition for jobs to less than 2 applicants per post. It is now clear what these strikes are really about. The BMA's fantasy demand for another 26% pay rise on top of the 28.9% they have already received. I also offered to extend the BMA's strike mandate so they could postpone this action and go ahead once flu has subsided. The fact they also rejected that offer shows a shocking disregard for patient safety. Since this strike represents a different magnitude of risk to previous industrial action, I am appealing to ordinary resident doctors to ignore the BMA's strike and go to work this week. Abandoning patients in their hour of greatest need goes against everything a career in medicine is meant to be about. The entire focus of my department and the NHS team is now on getting the health service through the double whammy of flu and strikes. We've already vaccinated 17 million people, 170,000 more than last year, and 60,000 more NHS staff. We've invested in 500 new ambulances, 40 new same-day emergency care and urgent treatment centres, and 15 mental health crisis assessment centres. The NHS will also be recalling resident doctors to work in emergency situations, and we will not tolerate the dangerous attempts to block these requests that we've seen from the BMA in the past. I'm proud of the way the NHS team has pulled together through strike action in the past, and I know they will move heaven and earth to keep patients as safe as they can this winter. I'm just appalled that they are having to do so without the support of their colleagues in the BMA.